guys, Connie here. I am 4 months post-op from my mommy makeover surgery, which included a breast lift, breast augmentation, 525cc implants, nipple correction, a full tummy tuck, as well as liposuction to the abs, flanks, and bra line. If you've been following along with my journey all along, thank you so much for doing that. To this day, I'm getting people messaging me, thanking me for documenting my journey so candidly. And so we're just approaching 4 months post-op, and I wanted to give you guys a few updates. All in all, everything is going super, super well. I hope you'll notice that I have lost some weight. My day of surgery, I was 165 pounds. I'm 5 feet 9 inches for reference. And today I'm 158 pounds. So through keto diet, which I was practicing prior to surgery, which I took a bit of a break from during post-op as per my doctor's orders, but I got sort of back on track at around 3 months post-op, maybe between 2 and 3 months post-op with my diet. And I have to say that the weight has just been melting off and I feel so awesome. And I can honestly attest to the fact that I am not having any issues whatsoever with swelling because of my diet. So once again, I don't eat any carbs except for naturally occurring carbs in food. I don't eat any sugar. For me, I sweeten my coffee, for example, with stevia. I really watch my sodium intake and I really watch my dairy, although I obviously do eat dairy, and I'm a fan of pink Himalayan salt if I do need to season something. But guys, I'm telling you that the keto diet is what's helping me keep the weight off, continue to lose more weight, as well as I think is the reason why I'm experiencing zero swelling. So I wanted to let you guys know that that's sort of the deal on that. So you'll note that from 12 weeks post-op, I was able to stop compressing. I was compressing between 6 and 12 weeks just at night. And after 12 weeks, I no longer had to compress anymore unless I was feeling a little swollen. So I kept my binder just in case, I was having a day where I was feeling a little bit more swollen. But since 12 weeks post-op to now 4 months post-op, I've had no days where I felt that my swelling was in need of compression. So there is light at the end of the tunnel for if anyone is, experiencing a lot of swelling even beyond 3 months post-op. I've heard of women swelling even 6 months to a year post-op. For myself, especially with the tummy tuck area, I am not experiencing any swelling. The only place I get maybe a little bit of swelling is sometimes in my armpit. Obviously, I did have quite a large amount of work done on my chest, and I will give you guys an update on my body and show you my scars shortly. But the only place I kind of feel a little bit swollen sometimes is maybe in my armpit a little bit, like today underneath this armpit, it's a little bit of a dull pain on the inside, but nothing, crazy, and not much I can do with that other than just continue to wear my SheFit bra for really good support as a sports bra. And wearing my underwire bras to continue to support my new chest and to protect my investment. Right now, I'm just in a little bralette just because I got out of the shower and I wanted to have something easy to show you guys my scars with. So yeah, what else did I want to tell you about? Okay, some interesting things to prepare for, and some of these are kind of embarrassing, so I apologize in advance. But if you were the type of girl that got little hairs around your areola, those hairs are going to grow in new places and different places. So for myself, it's kind of embarrassing, but I used to get random little ones around my old areola. And of course, my old areola was massive. And when they did my reduction, the whole areola was removed and made to 4 centimeters. And then, the breast is sort of tucked and lifted. And so I'm finding that whereas before, if I used to get some hair around the areola, now they're kind of in this area, in the incision, the vertical incision. So just be mindful of that. It's a little embarrassing, but I wanted to share that with you because you may not see them. And honestly, I just take a pair of tweezers and I pluck them if they do come out. And same with the tummy tuck. If you used to get any abdominal treasure trail hair, you may find that those kind of pop in new places. So it's just a maintenance things, ladies. I like to be really candid with you guys. Just kind of keep an eye out for those things. I guess it's a sign that your body is healing really well and that everything is operating as it always has, so that in a way that's a very good sign. I feel like over the last month, I've gotten a bit more nipple sensation back. Not 100%, not to the degree that I would say I had nipple sensation prior to surgery. But at 4 months post-op, I feel like every month, every week, I get a little bit more and a little bit more of that nipple sensation, which is great. The procedure took really, really well. So without further ado, I'm going to give you a sneak peek at all my incisions. And I know that that's what everyone really wants to see. So let me get this camera turned around. I'll give you a quick peek at this view. So you'll see there's my chest line. I'm dropping and fluffing really, really nicely. I'll show you guys sort of the movement I have. The implants are absolutely a part of me. I don't feel weird with them at all. I feel like my chest is my chest, you know, prior to kids. And I love my upper pole fullness. So in terms of the incisions, I'll give you a quick sneak peek. You'll see that the ones around the areolas are like basically completely hidden and blended now with my new areola. Same with this one. You can hardly see, very faintly, you know, you could see the white line, but otherwise it's doing really well. And then underneath, I mean, I'd have to lift my boob up to show you the under incision. So there it is. But like when I'm standing straight, the breast has dropped and fluffed enough now that it hangs over that incision. So you literally don't see it at all. And just to show you a bit of the vertical incision, there it is. And I mean, it's fading really nicely. So, I mean, I am not upset at all about my scars. I feel like they are doing fantastic. And I mean, most clothing I wear, bras, like you would never be able to tell that I had anything done, I feel, to my breasts. They feel like mine. So moving down, this is my tummy. You can see that I definitely have some more upper torso definition. I definitely have a line there. If I show you from the side, you can probably see it a bit better. And then going sort of down, like there's my belly button. And it's healing really, really nicely. I mean, there's obviously a scar, but it's on the very inside of the belly button. And I feel like every month it's kind of going from red to purple to kind of lightening. And it feels totally fine. No swelling or anything around it. Sometimes women get some swelling, especially around the belly button area for a while, but I'm not experiencing that. And then if you recall from my previous videos, my incision, here, let me just pull this all down. My incision is hip to hip. So right from there, and it's nice and smooth. I don't feel like I have any kind of dog earring, dog tailing happening, and it's completely smooth to touch. Like when I run my finger across this, although it looks maybe a little bumpy, it's absolutely not. It's actually very smooth. And once again, it sort of went from red to like a deep purple color, and I feel like it's lightening. Those are the holes from where my drains were, if you're wondering about that. And you'll see that my mons, you know, pubic hair area is obviously a lot more raised than what it was. I would say prior to surgery, my mons area was like down low like this, but obviously it's typical with a tummy tuck, especially if you're a smaller girl. Like I was 165 pounds pre-surgery. If you're a smaller girl, there's only so much they can pull your skin to meet this skin. So oftentimes, especially if you're a smaller girl, your mons area is going to be greatly risen. And that's been the hardest thing for me to get used to because I was such like a low rise bathing suit and clothing kind of girl. So, I mean, I'm definitely wearing more, you know, bikini cut items. Something like these Calvin Klein bikini cut underwear perfectly covers, you know, all of my incisions. This mark here is from liposuction, and this mark here is from liposuction. So I'm continuing to sort of, I'll say, kind of lazily treat my scars. I get a lot of questions about what I'm doing. So right now for me, the big thing is like moisturizing. Like my skin oftentimes feels dry, but that's just my skin in general. I use bio oil just to sort of even my skin tone and help with hydration. I find that my skin just sucks this up. It loves it. So just like lotioning my body, putting bio oil on and keeping it hydrated for me, I find is really helping. I do have like really expensive scar creams that were recommended by my doctor, like this Strataderm cream. And when I remember to do it, I sort of lather it everywhere, and I just kind of sit naked for a while till it dries up. So I am kind of intermittently doing scar treatment, but I will say I haven't been that diligent about doing any type of scar treatments. I should probably be more on top of it, but I'm really happy with how my scars are healing, and I guess I'm kind of lazy, and it's a bit of a production because there's so many to do. But you know, in talking to other women, my understanding is that these are eventually going to completely fade. I find it hard to believe at 4 months post-op, but everyone I'm talking to, I talked to someone at my dentist's office just this week, and she's like, oh my goodness, I had a tummy tuck 15 years ago, and you can't even see the line. So, I mean, I don't know how that's possible, but apparently it is. So I do still want to get the tattoo. Everyone's telling me not to do it because they're saying it's going to fade, it's going to fade, it's going to fade. I guess I'll have to wait and see how I feel about that and if I still want to do it. But guys, 4 months post-op, I'm a new woman. Dr. Kara said it to me when I woke up from surgery. This is the one thing I remember is, you know, I'm coming out of anesthetic and he's like, you're a new woman now. And honest to God, I am. This has been the absolute best investment in my life, in my future. I feel so much better without having that sort of midsection skin and weight. I feel like I'm not gaining weight in that area anymore. And if anything, if I did put on weight, it would probably go to new areas. So that's something I'm going to have to be mindful of. But guys, I'm in love with my new body, and I really appreciate all you guys, you know, joining me on my journey. And I'll continue to give you guys updates on sort of how my recovery is going. So that you guys can learn from my experience too if you're in your journey. So anyhow, this is 4 months post-op, guys. We'll talk again soon.